Knock, knock, knock. Hello. My name is Erica. I'll be your nurse for today. So your doctor has ordered an insertion of a urinary catheter or an indwelling urinary catheter or a Foley catheter. Do you know what that is? No? Okay, so let me just go ahead and quickly explain it. It's a soft tube that goes into your urethra and all the way up into your bladder, which then drains the urine that's in your bladder. And it drains it into a bag that's connected to the catheter. All right, it does look like you're having some urinary retention or you're not able to void or urinate, so which is why the doctor had ordered this, okay? Could you confirm your name and date of birth for me, please? Olivia Rodrigo, July 26, 2004. It matches the wristband. Miss Rodrigo, do you have any allergies, specifically to chlorhexidine, iodine, or latex? No? Okay, let me check for allergy wristbands. There is none. And then also, are you in any pain right now? No pain. Okay. All right. So let me go ahead and wipe down my table real quick, and then I'll explain the rest of the procedure to you, okay? All right. Hand hygiene over there. All right. We'll go ahead and clean the table for about 30 seconds. Were you able to eat breakfast today? Yes. Was it good? Oh, I'm so sorry to hear that. Yeah, hopefully it tastes better in the next few days. All right. All right, so now that my table has been cleaned for about 30 seconds, I'll go ahead and let it dry for 2 minutes. While that's drying, let me go ahead and quickly explain this procedure to you. So what I'll go ahead and do is I'll clean you with some hygiene wipes in your perineal area. After that, I'll go ahead and prep my sterile supplies, and I'll put on my sterile gloves, and we'll go ahead and clean you one last time with some iodine swabs. After I'll go ahead and insert the catheter. The catheter insertion should not hurt, however, you may feel a little bit discomfort. For this reason, what I'll have you do is take a deep breath in, and then I'll have you exhale, and as you exhale, I'll count 3, 2, 1, and that's when I'll insert it, all right? After I've inserted it, I'll go ahead and inject some water into the balloon that's at the end of your catheter just to stabilize it and make sure it doesn't move or like remove itself or dislodge inside the bladder. And then lastly, I'll go ahead and obtain a urine sample just so your doctor can see what's going on. And the last thing I'll do is I'll stabilize the catheter using something called a stat lock, and it attaches to your thigh so that way you can move around, walk around without the catheter getting in the way, and also so it just doesn't get tugged on. Okay? Any questions? No questions? All right, so I'll go ahead and perform hand hygiene again. I'll go ahead and close my curtain for some privacy. Per this procedure, you'll also need to be in supine position, so I'll go ahead and move you that right now. All right. And then is it all right if I lower your blanket down? Okay. I'll also go ahead and put your legs in something called a froggy position. All right, and then I'll just lift up your gown just a little bit. Okay, you doing okay? All right, hand hygiene. Hand hygiene again. I'll go ahead and put my gloves on. So I'll do 3 wipes, okay? All right. Okay. So I'll do 1 wipe in the middle. The side. And then the other side as well. Okay. Doing okay? Yes? All right, let's cover you back up. Do some hand hygiene again. Go ahead and place this away. All right. Now I'm going to go ahead and prep my supplies. If you could just give me 1 moment, okay? hand hygiene. I think I should have enough space. So for my supplies, I have my 10 milliliter syringe. I have my stat lock, extra pair of sterile gloves, and then I have 2 CHG wipes just in case I need them. And lastly, I have my catheter kit, which I'll just go ahead and remove from the box, from the plastic bag now. Okay, so go ahead and do some hand hygiene. I'll lift up your gown just a little bit now, so that I have some space to go ahead and put my drape down, okay? All right, hand hygiene. Gloves. Are you doing okay so far? All right. Okay, so now we'll go ahead and just open up the kit. Grab the drape. All right. I'll go ahead and continue to open this up. I'll remove my gloves and put it there for now. All right. Okay. Now I'll also remove this because I won't be needing it. And then I'll drop in some of my supplies. I have my 10 milliliter syringe. Drop in my stat lock, and then lastly my CHG wipe. Let's see if I can wiggle it out. All right. Okay, I've gone ahead and opened up all my supplies, prepped them. Go ahead and do hand hygiene again. I'll lift up your gown fully up now because we're about to begin the procedure, okay? All right. Hand hygiene. I'll put on my sterile gloves. Okay, I'll go ahead and leave that there. Now I'll prepare my supplies. I'll go ahead and just place some of my materials down. Open up my swabs. I'll go ahead and place my CHG wipe right here. My stat lock as well, I'll remove. Let's see. All right. So now that all my supplies are prepared, I'll go ahead and bring the kit over to you. All right. So what we'll do is we'll do the CHG wipe, not the CHG, the iodine wipe first. I'll do one wipe, another wipe, and another wipe. All right, you doing okay? All right. Go ahead and take a deep breath in for me. And exhale. 1, 2, 3. All right, see a flash of urine. I'll go ahead and advance 1 to 2 more inches. All right. Now I will grab the sterile water. Alright, now I will go ahead and pull until I meet resistance. I've met resistance. I will now go ahead and grab the port and my CHG wipe. I will scrub for 5 seconds. And I'll let it dry for 5 seconds. I'll grab my, almost dropped it. I'll grab my 10 milliliter syringe. I'll insert it and I will go ahead and pull back about 10 milliliters of urine. All right. Okay, now that that's done, I'll go ahead and hang this. Was there any pain during that? No pain? Okay, I'm very glad to hear that. All right. We are almost done, okay? Let's go ahead and just cover you up a little bit. I'll go ahead and remove my sterile gloves, do some hand hygiene. Okay. Alright, so now we're going to go ahead and grab my stat lock. Not my stat lock, my skin protectant, and I'll wipe the skin for about 20 seconds. I'll let it dry. While it's drying, I'll go ahead and just attach the tubing. Okay, let's go ahead and lock it. Alright, it's wet and dried now, so I'll go ahead and just stabilize it. Alright, you doing okay? Alright, let me just straighten out your legs for you. Pull down your gown. And then I'll go ahead and just do the urine sample. And we're almost done, okay? Hand hygiene. Alright. We'll go ahead and grab my container. Go ahead and inject. Alright, now I'll go ahead and write the patient's name, date of birth, MRN, the date and time of the collection. I'll leave it there so I can send it over to the lab. I'll go ahead and remove any materials I don't need by throwing them away. Do some hand hygiene. Alright, let's get you fixed up, Miss Rodrigo. Would you say you tolerate the procedure well? Yes? Okay, glad to hear it. Any pain? No pain? Feeling much better, actually? Glad to hear it, glad to hear it. Looks like you are. The urine is draining, so that's very good. Just a couple things. The first few times that you do get up, I want you to go ahead and use your collar to call me, just so I can help you walk around and all that with the catheter, how to handle it, how to move around and work around it, okay? Does that sound good with you? Yes? Okay. So I'll go ahead and lower your bed. Side rails up. Here's your call light so you can call me. Do you have any questions? No? All right. Glad to hear it. Thank you. Go ahead and do some hand hygiene. Grab my specimen. Clean, close the curtain. Send this off to the lab. Hand hygiene. Now I'll go ahead and document the date and time of the procedure, the patient's tolerance to the procedure, the catheter size, which is 16, and then the urine characteristics like the color, odor, amount, and if there was any sediment. Hello, my name is Erica. I'll be your nurse for today. Looks like your doctor ordered a removal of your indwelling urinary catheter, your Foley catheter, so we'll go ahead and do that today, all right? Okay, I just performed hand hygiene. Could you confirm your name and date of birth for me, please? Olivia Rodrigo, July 26, 2004, matches the ID wristband. Miss Rodrigo, any allergies? No allergies. I'll go ahead and look for an allergy wristband. There is none. And lastly, are you in any pain, Miss Rodrigo? No pain. Okay, so let's just run through this, how this is going to go. I'll go ahead and prepare the room. I'll go ahead and close the curtain right now. I'll put you in supine position. I'll lower your blankets. I'll lift up your gown. I'll put your legs in froggy position. Then I'll go ahead and place a brand new pair of chucks. After I go and do that, I'll destabilize the catheter from the stat lock, and then I'll go ahead and withdraw the water that's in the balloon at your end of your catheter. Once I've done that, I'll go ahead and have you take a deep breath in. I'll go ahead and say blow it out, and that's when you'll blow out, and I'll slowly remove the catheter. Okay? Don't anticipate any pain or discomfort, but if it does happen, please let me know immediately. After I've done that, I'll go ahead and take the catheter and the chucks and all that, go to the bathroom, measure it, dump it out. Then I'll come back here, have you, I'll go ahead and remove the stat lock from your thigh, and then we'll go over some patient education, and then we'll be done, okay? All right, so let me go ahead and just do some hand hygiene. I've closed the patient's curtain already. Okay, let's go ahead and put you in supine position. Can I lower your blanket? All right, thank you. Go ahead and lift up your gown. Froggy position. All right, okay. Let's go ahead. I'm gonna go ahead and do hand hygiene again. Do some brand new pair of gloves. All right, let's go ahead and grab my supplies. I'll go ahead and open up my syringes. This is my alcohol pad. All right, okay. Let's go ahead and place this brand new pair of chucks. Okay, can I lift up your gown a little bit? All right, thank you. Go ahead and do hand hygiene. All right, let's go ahead and destabilize the catheter. You doing okay? Yes. All right, grab my syringe. And I'll pull back around 10 milliliters. All right. Okay, I'll go ahead. Take a deep breath for me. All right, blow it out. Amazing. If I would have met resistance, I would have taken my second syringe and attempted to pull back more water. If that did not work, I'll go ahead and stop and call the provider. Let me just take this to the bathroom to measure. All right, I've measured it, dropped it in the proper receptacle. I measured it with a graduated cylinder. There was 250 milliliters of urine. I also observed the urine's colors, the characteristics, like color, odor, amount, and then if there was any sediment. Okay, let's go ahead and get the stat lock away from you. Any pain during that? No. All right, I removed the stat lock with an alcohol swab. All right, let's just go ahead and remove all my supplies. Hand hygiene. Okay. Would you say that you tolerated that well? Yes, okay, so glad to hear that. Let's go ahead and lift up the head of your bed. All right, just some patient education real quick. So, now that I've removed your catheter, you may notice that within the first few voids you do, or first few urinations, you will notice some burning, some stinging, and may even see a pinkish tint. That is all normal and expected, and it should go away the more you void, and it'll just lessen over time. However, if you do feel some increased bleeding, increased pain, or you're unable to void, I need you to let me know using your call light. And also, the first 1 to 2 times that you do void, I want you to go ahead and call me so that I can go ahead and measure how much urine you're outputting. And this is just to make sure that you're adequately emptying your bladder. All right? Any questions? No questions? Okay. Let's go ahead and lower your bed, side row up. Here is your call light. Make sure to call me, okay? If you have no questions, I'll go ahead and leave. Thank you. Oh, hand hygiene. I've now left the patient's room. I'll go ahead and do my documentation of the date and time of the procedure, the patient's tolerance to the procedure. I would document there was 250 milliliters of urine, the color, odor, amount, and if there were any sediment, and then I would also document the next 1 to 2 voids.